And today I have a very, very special guest with me, Dr. Lorraine Day. Dr. Day is an internationally acclaimed orthopedic trauma surgeon and best-selling author who was for 15 years on the faculty of the University of California at San Francisco School of Medicine as associate professor and vice chairman of the Department of Orthopedics. She was also chief of orthopedic surgery at San Francisco General Hospital and is recognized worldwide as an AIDS expert. Dr. Lorraine Day has an amazing story about how she refused traditional cancer therapies and reversed her severe advanced cancer by rebuilding her immune system by natural therapies so that her body could heal itself. She has been invited to lecture extensively throughout the U.S. and the world and has appeared on numerous radio and television shows, including 60 Minutes, Nightline, CNN Crossfire, Oprah Winfrey, and she joins us now for the first time on the Republic Broadcasting Network. Good morning, Dr. Day. Welcome to the program.
Thank you very much.
Bless your heart. You got up early for this show because you're in California.
Well, yes, it's still 7 o'clock. It's not that early.
You have a very inspiring story of how you responded to your diagnosis with cancer. First of all, tell us what type of cancer that you were diagnosed with.
Well, I was diagnosed with breast cancer, but it doesn't matter what cancer you're diagnosed with. All cancer is really the same. Patients are told by their physician that each cancer is very different and has to be treated very differently. However, they're all treated the same. They're treated either with chemotherapy, radiation, or surgery. Those are all the same. Whatever brand of poisonous chemotherapy they use doesn't make any difference. It's still poison and it's still chemotherapy. So it's all the same.
Yeah. Well, how did your physicians react when you told them that you were going to refuse traditional therapies like chemo?
Well, of course, they were my colleagues, and they thought I was crazy because I had gone to the same medical schools they had, and I had learned the same thing, which is really propaganda. You see, you cannot make a sick person well by giving them poison or by burning them or by taking out their organs. You can't do that because cancer is not caused by a deficiency of being poisoned. It's not caused by a deficiency of being burned with radiation, and it certainly isn't caused by having too many organs. You know, I had breast cancer. I didn't get breast cancer because I had too many breasts. Cutting them off does not solve the problem. Cancer is a systemic disease. If you had a child with chickenpox who was very sick, you would never take that child to a surgeon and say, cut out all the pox marks in this child's skin so they'll be well.
Absolutely.
Cancer is a systemic disease. The tumor is not the problem.
The whole philosophy behind traditional therapy, which is just cut out the problem and it'll take care of it, but you and I both know that is not the highest and best good for the body.
No. With cancer, as I said, it's a systemic disease. It affects the whole body, and even though a person may not feel sick when they are diagnosed, as I did not feel sick when I was diagnosed, but the whole body is sick. And the tumor is just the local manifestation of a totally sick body. If you take out the tumor and you don't change the sick body by getting it well, then another tumor will form either in the same location or in another location, or you'll get another life-threatening disease. What we have to do is get the body well, not just, take out the tumor. You can't cut cancer out. You cannot cut cancer out. At the beginning, as an Orthodox physician, when I first developed cancer, I thought, well, I have a biopsy and maybe they can get all the tumor, but that doesn't make any difference. They biopsied me, and 9 months later my tumor was back because all I had done was change my diet. Well, changing the diet is the correct thing to do, and I was on the right diet. But getting well from cancer or any other serious disease is a lot more complicated than just changing one's diet. You have to do that because everybody's eating so terribly nowadays, and that is one of the major causes of disease, but it is not the only one. And so it's what we say in medicine is a multifactorial problem. In other words, there are many factors that cause disease, and they all work together. But you really can get them down to 3. The 10-step plan that I use to get well is simple, but it's not easy. It's simple because it's very easy to understand, but it's not easy because you have to change the way that you live and you eat. And people don't want to do that. What they want to do is they want to eat and live any way they want and then go to the doctor and get a pill. But a pill just covers up the symptoms. It doesn't change the course of the problem. And that's what you have to do.
And we need discipline with our bodies.
Well, that's right. We do need discipline with our bodies. And but people can start, if they don't have a serious disease, they can start easily. I'll just, first of all, I had this huge tumor. If you go to my website at www.drday.com, drday.com, and you look at the tumor I had, it was the size of a softball. It was huge. And it grew to that size, from the size of a marble to the size of a large grapefruit in 3 weeks. And but by that time, I had already been trying to get well. I had refused chemotherapy and refused radiation, refused mastectomy, and but the only thing I knew how to do was to change the way I was eating. But over a period of time, I got much sicker. And at one point, I hadn't been able to eat for 2 weeks. I hadn't been able to drink anything for 3 days, and I was getting very close to death. And but I still refused all traditional therapies because as a physician, I know what chemotherapy and radiation do to patients. I know that. I've seen thousands of patients die from the treatment we give them. Most cancer patients do not die from the cancer. They die from the treatment. And what a cancer patient will say is, oh, well, I had cancer, and then I had chemo and radiation, and my cancer went away, and I was fine for a couple of years. But then it came back, and when it came back, it was all over the place. Well, it didn't really go away, and they weren't fine for 2 years. What happened was they were given poison, which poisoned a lot of the cancer cells, but it also poisoned the cells of their immune system, which is the only system in our body that can get us well and keep us well. So when their immune system was poisoned, then the cancer, which always comes back, it always comes back, but if a person has enough immune system left, they may be able to fight it for a while. But if your immune system is destroyed, which it is destroyed by the supposed treatment, the chemotherapy or radiation, then it spreads everywhere. And people have, like with breast cancer, they'll have their lymph nodes removed. Well, if the cancer is in the lymph nodes, that's because the lymph nodes are doing their job. If you have an infection in your foot that travels up your leg, the lymph nodes in your groin will get firm because they'll be involved with the infection. What they're doing is they're stopping the infection from spreading. It's part of your immune system. Nobody with an infection in their foot would ever dream of having the lymph nodes in their groin removed. But yet women have these lymph nodes removed all the time because there's cancer in them. Well, they're doing their job. They're keeping it from spreading. If you take the lymph nodes out, then you have no barriers to keep the cancer from spreading. And then if you have chemotherapy, which is absolute poison, the first chemotherapy agents were nitrogen mustard. That was World War II killing gas.
Yeah.
And it's still being used. And so people are just paying the doctors to destroy them. And I could see that. As a physician, a long-term physician, I have been a physician for many, many years, and before I developed cancer, I thought, man, this is crazy what we're doing. We are sending these people, taking sick people and giving them poison and expecting them to get well. It doesn't work that way. And whether it's cancer or Parkinson's or Lou Gehrig's disease or lupus or any of these diseases, even heart disease, you do not get well unless you stop doing the things that are causing them and start doing the things that will reverse them. But doctors say, we don't know what causes cancer, as though it kind of just drops out of the sky. Or it was your heritage that gave it to you. It's in your genes. It is not in your genes. All you have to do is look and see that in 1909, the incidence of cancer in America was 1 out of 33 in 1909. By 1985, it was 1 out of 3. Now it's 1 out of 2. If it was our ancestry that did it, then our ancestors, our mothers and grandmothers, would have had as much cancer as we do. But they didn't.
I want to ask you about the radiation. So you're saying in getting a mammogram that a woman is being exposed to radiation. So even not just the treatment, if you are diagnosed with cancer, is going to continue to increase your risk, but you say that also the thing that is supposed to detect and or prevent are mammograms that are also increasing your incidence of cancer. Is that correct?
On my DVD, Cancer Doesn't Scare Me Anymore, I show that every time a woman gets a mammogram, she increases her risk of getting breast cancer by 2% with every single mammogram, because it is radiation. It's radiating your breast. Doctors know that radiation causes cancer. Radiation causes cancer, all right? And you say, well, then how will I find the lump? Well, a breast exam, a physical breast exam by a physician, has been shown to be just as accurate as a mammogram. And it carries no risk, and it is no extra cost. But you see, they have developed all of these very expensive devices. And what the patients don't know is when you're a doctor and you are on the staff of a hospital, if you don't send all these people for mammograms, the hospital comes after you because they have to keep those machines going so they'll pay for themselves. And so there are tumor boards where you're called up in front of the tumor board if you don't send a patient for a mammogram. They're very expensive, and they're harmful to the patient. Not only that, if you have a tumor in your breast, anybody who has had a mammogram realizes that this is a crazy thing to do. They squash your breast and shove it down, and of course, the X-ray technician runs out of the room and hides behind the lead wall, which is what they should do.
Right.
Okay? But you're getting X-rayed with this stuff. And so some women after menopause will be told that they need a mammogram every 6 months. Well, pretty soon they have increased their risk of getting the disease they don't want to get by 20% within about 10 years or 5 years. They will increase it enormously just by getting the mammograms. And you don't need to do that. So everything in medicine is upside down. The plan that I use to get well is designed to be done at home, and it is virtually free, except for food. You have to buy food anyway. You might as well buy good food instead of junk food. And the plan briefly is the proper diet, exercise. A woman can reduce her risk, and all these things I'm telling you are about all cancers. We give cancer to ourselves a day at a time by the way we live and the way we eat. Fortunately, we can reverse it. It does not drop out of the sky, and it doesn't come from our parents, except the only way it comes from our parents or our grandparents is great-grandmother teaches grandmother how to eat, live, and handle stress, and grandmother teaches daughter, granddaughter, all the way down. If your parents and your grandparents had a lot of cancer or heart disease, and you eat and live the way they did, you'll get the same diseases.
A lot of it, learned behavior. Yeah. Yeah. I wanted to mention something. Now, when I was in college, I dated a med student, and sometimes we would study together. And I was amazed one day when I realized that all that he was studying was sickness and disease. He didn't study health. And it was an interesting revelation for me, because when I go to the doctor, I assume that he knows what a healthy body is, but they're trained to observe and understand what a sick body is. And that was a real paradigm shift